Good afternoon to everyone, and welcome to the Healthy Flint Research Coordinating Center's community webinar on coronavirus. Can you believe we are now at week 37? And I'm delighted to have the opportunity to be your moderator for today. My name is Yvonne Lewis, the director of the National Center for African American Health Consciousness and co-director of the Healthy Flint Research Coordinating Center. We have had 37 weeks of a wonderful partnership. For those of you that are viewing us on Facebook, maybe for the first time, you see our banner here. We are appreciative of every one of these organizations that have joined us from week one, many of them, through these 37 weeks. And today, even though it is the Friday after the first major holiday of this season, Thanksgiving, we have some committed panelists here that are going to share with you. I'm really excited today because I have the opportunity to do something that I've wanted to do for a long time. We have been able to bring this webinar to you with panelists every week speaking on specific topics. But today we're going to have a little bit of a different format that we trust that you will enjoy. We've had individuals from even outside of our community join us for these webinars. And so we trust that you too will find the information that we share helpful to you in your everyday activities, as well as those of us who are in the community identifying the awareness about programs and services that are available to you in the community. Today we have with us some special guests. I'm going to introduce them with their official titles, and then we're going to just talk as if we are sitting around my kitchen table with your cup of tea. So I brought my cup of tea with me today, and I'd like to welcome to our program this morning, our panelist, Dr. Lawrence Reynolds, who is the Chief Health Advisor for the City of Flint. And then we have with us Dr. Deborah Verholden. Dr. Deborah Verholden is the Associate Dean of Public Health Integration at Michigan State University. We have with us Mr. Isaiah Oliver, who is the CEO of the Community Foundation of Greater Flint. We'll have with us Suzanne Kupel, who is the Public Health Division Director at Genesee County Health Department, and Dr. Susan Wolford, who is the Associate Professor at the Susan B. Meister Child Health Evaluation and Research Center, that's a mouthful, at the University of Michigan in Ann Arbor. And I'm so excited for those of you that have joined us. This today is some real talk. We're going to talk a little bit for a few minutes about what happened yesterday. Yesterday was Thanksgiving, and so I'm going to invite to this conversation first. We're going to have Dr. Reynolds, who I'll call Dr. Lawrence, Dr. Deborah, and Isaiah Oliver. Yesterday, big day. Our governor asked us a couple of weeks ago that we would prepare for this holiday by getting in our little bubble, having a small group of our family members or not more than 2 households join together. So for you all, I want to ask you, and Dr. Wolford, how did you spend yesterday? What did you do? And let me start with you, Dr. Reynolds. What did you do yesterday?
Well, yesterday it was just my wife and I and the dog. And we Zoomed or FaceTimed family members, and we laid quite low. I think I went outside one time for 5 minutes. That was just me that day. And I binge watched. So I tried to adhere to the program, and I'm thankful to say it maybe took me a week of conversation, but I convinced my son not to fly in from Dallas, and he stayed in place. So mission accomplished.
Okay, well, let's hear from you. Dr. Deb, you and I had this conversation, and so I just got to ask you. So you did what you did. What did you do?
Very heartbreakingly did not do what I really wanted to do, which is I wanted to go to Baltimore, and I wanted to be there with my daughter. I've been divorced now for 17 years. My youngest daughter has never had a Thanksgiving with her dad and his new wife and her stepbrother and sister and all. And we had planned this massive coming together of our 2 households. It was going to be a real, treat for us because we've, 17 years later, really figured out how to be a family and be great with one another.
Mm-hmm.
My ex-husband is diabetic. In the face of the numbers in Maryland and Baltimore and in Michigan, this great gift that I wanted to give my COVID 2020 graduate who missed prom, first world problems, but
Yeah.
she's a first
Yeah.
world girl. This is all she knows. She missed prom, got her graduation diploma through the car window and all of that. So we had to cancel that plan. And instead we had a family FaceTime chat. And we had a single household Thanksgiving here in Flint. And it was safe. I was protected, and I used the time to reach out to loved ones. So I had a lot of conversations with some of my loved ones, a former neighbor, a teacher, a friend from high school. I just used it as a time to be in communication with people and fellowship at home with my household.
Yeah. So that what was happening for me. I want to step outside of Flint a little bit and go to Dr. Susan, who is a little bit south of us. So how did you spend yesterday, this day of Thanksgiving?
Well, it was a little bit different from my typical Thanksgiving. Usually we'll go to my husband's family in Pittsburgh, but because of the pandemic, we stayed home and we zoomed in to family and friends. We actually ended up zooming into 3 different meals. So I will spend Black Friday, or at least today, exercising off some of all of that food. So we connected with friends here, with my sister who lives in the Southwest side of Michigan, her family, and with my husband's mom and his siblings who live in Pittsburgh. She's elderly, and so it really wasn't worth taking the risk to go there. And so we had to do it all electronically. And then we had the opportunity to call a lot of members from my husband's, the churches that he pastors, who were alone, who, I think it's okay if there's more than one of you in a house to spend the holiday together. But when you're alone for the holiday, that's so much harder. So we spent a lot of time trying to connect with those families as well.
Yeah, and this is a different time because this is usually when we get together groups in large groups and enjoy. And we have a father here who has little ones. Most of us already, we've got big people, even though they're precious to our hearts. But Isaiah, you have little people in your house. How did you handle yesterday?
Oh, thank you. Thank you for one.
Can we see your face, Isaiah?
Yeah, I'm sorry. I thought.
Yeah. Oh, see.
I apologize. I forgot I wasn't showing face here.
Yeah.
No, I've got 4: 9-year-old, a
Okay.
6-year-old, a 3-year-old, and a 1-year-old, and we're trying to figure it out. They are just now my 9-year-old clearly understands the holidays and what to expect, and she understands that this is different, and this year has been different, and yesterday was a bit different than our bigger family gatherings. Little ones are just now experiencing this time of year. And so we are really creating what it is for them, and what will happen in the future will likely be different. And so lots of conversation, lots of talking at my house. We had some really good food, like most, enjoyed some time with one another, watched some movies, but it was a lot different than our typical holidays together.
Yeah, I think all of us are trying to figure this thing out. Suzanne Cooper, what did you do yesterday?
I had a lovely quiet day at home. I'm going to go later this afternoon to my brother's house and pick up my Thanksgiving dinner and enjoy it for my dinner today. So he did the cooking. I'm going over and I'm going to get leftovers, but I spent the day working on things at home.
Okay, so I got a question for you, and we have these we call them the doctors in the house, but I want to just have us break this down a little bit. It's Thanksgiving. We're getting into the holiday time, and it's so much going on and so much being said. So most of us have confessed that we did the bubble thing, and I want you to talk about the bubble a little bit too, if you could, Dr. Deborah, as we're engaging our participants. We would love for you, if you've joined us by Facebook or you've joined us, if you can still send some questions in, you can shoot those questions. We've got somebody that's monitoring Facebook. So if you've got some comments that you want to make, because we want to know from some of you how you spent your holiday too. We know we're getting a lot of mixed information about this, and I witnessed in my neighborhood, I witnessed cars across the street from me. I mean, a lot of people showed up yesterday. Dr. Deborah, Dr. Reynolds, they had a pit out in the garage. They were frying the turkey, and everybody there were cars bringing in different dishes. How is this going to affect what we should be expecting in the next few weeks? What does this mean if people did not actually stay in their little bubbles? Dr. Deborah, can you lead us off on that conversation?
I know Dr. Reynolds got something to say. There's now post Thanksgiving. He ready.
He rocking it.
Yeah, there's the post Thanksgiving. Now what? And so people came together. The only thing they can safely do is go into self quarantine, and then they also now have to be tested. You know, my biggest concern about people just plowing ahead with Thanksgiving plans as is that it would cancel Christmas. We haven't thought about that. Remember, our rates, COVID rates in Flint and Genesee County have tripled between October and November. So we were already on an upward trajectory. And they call these events and these occasions super spreader events. And Thanksgiving only had the potential to be a super spreader event if people conducted themselves business as usual. So we might have the wrong choir here all singing on key, but you know, a lot of our community are kind of singing off key, and they did what they normally do without really regard for the fact that that could put them and their families at elevated risk for sharing the virus among themselves. So it's important now that if people did that they be in self-quarantine, because not only will they have potentially been harmed or caused harm on Thanksgiving, they also then become the people who take it back to their workplaces, to their households, to their communities, to the markets where they shop, and all of those other things. So now people need to get tested. They need to be in self-quarantine. And I'm just really prayerful that we don't see some really bad fallout from Thanksgiving. But now is the time for people to start planning and preparing for Christmas. If you want Christmas to look a little bit different than Thanksgiving did, it really is important that people start to share, create these social pods within their family, set down rules and criteria for who can come together and what that will look like. It won't look like likely how Christmas last year looked, but there's a lot that people can be doing now to make sure that they're safe following Thanksgiving and to do a better job in preparing for Christmas.
So Dr. Reynolds, what say ye? I mean, you're the chief advisor for us here in the city of Flint, which we appreciate. So tell us.
Well, what I will say is this. Today is Friday, and you're all already being encouraged to come out and participate in the shopping crowds. I repeat my warning. If you have a plan, stick to it. And if you show up at a place and it doesn't look right, get in your car, back up, and go home. The other thing is you don't need to take Lottie Dottie and everybody to the mall if you insist on going out. Leave your children at home. Leave people my age and older at home. I understand it's the holiday season and we want to act like everything is normal, but this is the new normal. And then
Yvonne,
lastly, I'd say people like to look at today's numbers as far as new cases. And they say,
Yeah.
oh, new cases are low right now in Genesee County and some parts of the state. However, wait 2 to 4 weeks when people finally start getting tested after the holiday. Wait the 2 to 4 weeks and see how hospitalization rates go up and death rates go up. This is a highly contagious virus, and we are learning new things about it every day, some good and positive, some unfortunate and negative. So we can't act like the situation is under control. We are in a pandemic. So please, as Dr. Furholden said, if you were out there yesterday, you need to get tested probably Monday, Tuesday, or Wednesday. And that just tells you about your status now. If you feel sick, get tested. If you're going out shopping, you're going to need to get tested in 3 to 4 days. So if you've never been tested, you need to get tested. And we need to take our children to get tested also. So this is the responsibility that we will have. And may I talk about the vaccine briefly?
Well, if you give
And
us a
that
minute,
is,
because we're going to come back to those
I
vaccines,
can't
Dr.
hear you.
Reynolds. We're gonna come back to the vaccines. So
If you're
because we
saying
want
no, just do this.
to, yeah, because I want to. Can you hear me?
Yes,
Yep.
we can hear you.
Okay, because I want to bring Isaiah back. You said something, Dr. Reynolds. You said don't take everybody to the store with you, and I fall into that older category. You know, my children, they treat me almost like I'm a break any minute. You know, they don't want me to go out and do anything. But you also said the children. Now, Isaiah, you're here, and you have small children. How does this all affect what you're trying to do in this season?
You know, we don't typically take our kids to the store anyway, and it had nothing.
Okay.
COVID, it had everything to do with a whole bunch of crazy people trying to get to the first TV they can get to. So we don't typically do that anyway. But I will tell you, part of me, and this isn't exactly a struggle, but I think the reality is that if we are going to use what I would describe as scare tactics, like we're going to use the data to scare people from engaging with their family, we've known probably since 4th of July that doesn't work. People are watching the trends. They're seeing people dying. They understand what's happening at hospitals, and still something is still drawing them to be close to either family traditions or family members that they love. And there's something to say about the mental and emotional health toll that the pandemic is having on folks, and what it means when you get that and holidays happening at the same time. Like, and so what do we offer to be, I mean, should they be journaling? Should they be finding a special friend to talk to, a pen pal? I mean, what is the real way to address some of these mental and emotional health issues that we know are existing? Because people aren't making a decision to come together because they're all rebels. There is something that's drawing them to the physical and emotional connections that they have with family members at this time. And it's more powerful right now than all of the imagery and all of the news that we're seeing. It's something more powerful than that that's pulling people to come together with 10 or 15 or 20 people during the holidays. And so what do we do, or what do we say, or what do we offer to people at this time where we know they're looking at the same numbers we're looking at and still making a decision to come together?
Isaiah, you just got a good yes, Isaiah, from somebody. They like, you talking it now. Well, so I want to. Well, you're creating though a really important, generating a really important conversation. So we do have, you know, pediatricians here on the line with us, and then we have an epidemiologist. But I want to go back and get some feedback from them on this issue that you raised, because it is a mental health issue. It's like, I just can't do it and be alone. Dr. Wolford, what say ye about this?
So I think that Isaiah raises a really good point of what is the motivation and why will people do it? And why will people gather together and put themselves at risk? And I agree, there's a very strong force, because we are social beings, to get together. I also think that, and maybe it's because of the people that I'm around a lot, there is an idea that, you know, God is going to protect us, so we can gather in church. God is going to protect us so we can sing songs. God is going to protect us so we can do it. We can go ahead and do this. And I think that's a difficult one to wrestle with. But I was thinking about a story this week of when Moses, his mother put him in a basket to protect him and put him in the Nile, right? That they couldn't go about doing their normal things with babies. Otherwise, the babies would die. They had to do something different. They had to put the baby in a cocoon in order for that baby to survive. And I think right now we have to put our babies in a cocoon. Anybody that you love needs to be in a cocoon so that they can be protected against this virus. We know that infections wipe out populations, right? We're celebrating Thanksgiving, and we know what happened when what happened to Native Americans when exposed to viruses or to infections that they were not used to. It wipes you out. And we are facing a virus that we are not used to. And so the only thing that we can do until we get the vaccine is to get that in that cocoon and find a way to be in connection. The journaling was lovely, the phone calls, we have to get to that so that we can protect ourselves and our community and those we love.
So So, yes, Suzanne.
There are things that we can do, though, that we have traditions. So again, I gave you the example that my brother cooked yesterday. Now, I couldn't be with my family for Thanksgiving, but today I'm going to get leftovers from them. We can decorate our holiday tree and send pictures to one another. We can do some traditional things that we would normally do, just do them in a slightly different way and share them in a different way. But having those comforting things around us also is another way that we can fill that emotional gap, if you will, and prepare ourselves for the holidays.
So thank you for that, because there are things that we really want to encourage people to think about, because we, it's a really interesting thing. We want people to have a heightened sensitivity to this, but we want them to be in a place where they make good decisions. And hopefully these webinars have contributed to that good decision making. And so again, while I'm at this point, I want to encourage you, if you're on the webinar and you can send us a note via Facebook or put something in the chat that can help spur this conversation today, we really would appreciate that. So Susan, you mentioned, putting our babies, our loved ones in this bubble. Dr. Reynolds, you mentioned, the older and the younger. So I felt really special because I kind of can fit in that little baby bubble, even though I'm an older one. So you have some other insights about this bubble. How do we create it in a way and help people see it in a way that is not threatening but important for us to do?
Well, one recommendation is that we find another household that is willing to go into quarantine. That means stay out of the mix as much as possible for 2 weeks prior to the gathering. And also, they'll check their temps before they leave their household to come to your household. And you will check your temps at your household. And if anybody's sick or feverish, the commitment is to stay home. You can gather with those two households, less than 10 people, at separate tables. Don't share eating utensils. Have the utensils cleaned after each person serves themselves. And all these things are important because there are asymptomatic carriers, in other words, people who have the virus who can spread it, pre-symptomatic carriers, in other words, people who will show their symptoms 3 or 4 days later. And so we can be well intentioned about, I feel good, I feel well, and I'm going to do it just like we used to do it. But this is where you have the opportunity to gather with another household or pod and get some of that interaction. But there's still those rules. You don't blast the oldies but goodies, and you don't sing at the top of your voice. Let the radio, your radio, you can tell how old I am. Let your system do the provide the sounds. So there are things you can do. And yes, to Brother Isaiah, these are trying times for people. I will share with you, I just lost a 25-year-old nephew in Charlotte, not to COVID, but to suicide.
Mm.
Now, understand, being 25 and you're trying to get established, you don't see your job prospects, whether you have a high school diploma, college degree, or not. You see your whole life in upheaval. So, yes, making that connection is important. And it's challenging to track down some of these young people that we interact with. But this is our challenge now. And then you have to make decisions. I'll stop there.
Yeah, this is a lot to think about, because we're hearing so many things, and the data is out there, and this is for you, Dr. Deb. The data is out there, and sometimes it's so confusing. How do we really get a good grasp on the data so we can make good decisions?
Well, and I think Isaiah raised a good point, and others have brought this up. I think people are acting on something other than the data itself. I don't think the data in and of itself is enough. But I think of instances, back in March and April and May, where we had funerals, and 6, 7, 8 members of a family contracted the virus at a funeral. There was an example of a family down south, I can't remember exactly what state. The entire family, the first degree relatives, the mom died, the children, and they were all adult children, and their children all contracted the virus, and 6 of them died as a result of the exposure that they got at the funeral. You know, I think we're at that point where most people, if you don't know somebody personally, you're like 1 degree of separation. You know somebody that knows somebody. It's just unfortunate because it's competing with the people are lonely. People are trying to find some semblance of a life that makes sense to them. You know, like I said, I had this high hope. I was so excited for my daughter to have her very first Thanksgiving with, you know, her mom and dad and her step siblings and all of the extended family. And when we really looked and we weighed it all out, I said, baby, the risk, what happens? Your dad, who's diabetic and has been hospitalized twice this year, what happens if one of us actually picks up COVID at the gas station? Because we were going to drive, we were going to do everything that we could have done, we would have done. What happens if your dad contracts COVID and there's somebody who doesn't fare well with this illness? Could we forgive ourselves if we were the ones who brought COVID to the party? If we were the ones who brought COVID? Because what that will do is cancel out future opportunities to have this kind of fellowship where we bring our families and our households together. So I think we need a little bit more. And I would love, as an epidemiologist, for people to be driven by the data. I would love for all policy to be driven and informed by data. I would love for people's actions to be influenced heavily by what the data are telling us. And unfortunately, that's just not the case. So I do think we need to try to give people what are the real tools and strategies that you can use. I don't like this Monday morning quarterbacking. I don't like trying to tell people what to do because I know they did what they did on Thanksgiving. Now what? But I'm willing to have that conversation. And what I can guarantee is we're going to see the impact of people doing what they did in the weeks to come. So I would really like to start that conversation now for how people can prepare for Christmas. What is a social pod? We're going to talk about it later, I think, but what is a social pod? How do you construct a social pod in a way where you can have a more than one household Thanksgiving? What does that look like? How many people can you have? What do you actually have to do that with the kind of rigor that would allow you to come together, but not elevate risk of exposure for people in your social pod or people in the family that you're just really intent on seeing? So I'm looking forward to that conversation because I want to give people the tools so we don't have to cancel Christmas, but we are going to have to deal with the fallout from a lot of people did what they did on Thanksgiving.
Yeah. You know, I was thinking yesterday, one of the things we did, my son is in Texas, and that my 2 grannies, I call them my 2 grannies in Texas. And so we did the phone thing, and they're jumping and running, but we had already planned because things were looking like they were going to be better. We'd already planned for Christmas. That my daughter in love, we do the pajama Christmas thing. I don't know how many of y'all do the pajama Christmas thing, but she'd already ordered the pajamas. They already arrived at my house. My son calls and said, "Ma, I got news." He works in the community in Harris County. He does their social media. He got a call that he'd been exposed. And so now it's like, do we have to cancel Christmas? I'm already crying because I don't want to cancel Christmas. I'm re-cleaning up my house so I don't have to cancel Christmas. But it's a real conversation. And so Isaiah, I want to just go back to you for a quick minute because again, you know, when I think about my little grannies and I think about my big children now, my adult children, for me, they're still my babies. I still want to hug them and love them. And so we're still trying to figure out how we're going to make this Christmas thing work. So I don't know, you know, some people don't do Santa Claus, but as we start to shift the conversation to talk about what's next, what do you think your conversation will be with your children around the Christmas season? How are you beginning to think about what you will say?
I mean, first off, I mean, we got to have a conversation about Santa. He going to all of these houses and then he's still, that's a problem outright.
So that's a problem, right? Because he may be asymptomatic, right?
Santa just can't be going to everybody's house. He's clearly going to somebody's house with COVID if he's going to every house. No, but I joke there, but I also think that is interesting. I probably do need to have a conversation with my kids who a few of them still believe in Santa, and right, and they also understand what's happening right now. They might have,
Yeah.
and I might have.
Dr.
So funny thing is, I probably do have to figure out how to answer that question.
Yeah.
Dr. Fauci has said that Santa has an innate immunity to COVID-19.
Oh, that's interesting. And if he has said that, that's going to be interesting. My kids are really smart. They want to know how we get it.
Yeah.
Yeah. Yeah.
If Santa
And that
got the
would be a
cure,
great Christmas
why don't
gift.
we have it?
Give me that. I
Yeah.
want
Yeah.
that
Yeah.
for
Yeah.
Christmas.
Oh man, but I tell you, Christmas is going to be different, much like Thanksgiving was, and we are going to have to be thoughtful about how we have conversations, not only with our kids, but quite frankly, it's my grandmother and my great aunt and those folks who are saying, listen, there is some privilege that comes with the ability to kind of prepare weeks in advance for socially gathering for Christmas, right? I work in a job where actually we work from home right now. So I can try to plan out the next 14 days to make sure I can spend time with Granny and my great aunt. But the folks in my family who have the least ability to quarantine for 14 days are the ones that we want to have around. They're the folks that you want to have close to you. They're the folks that you want to put eyes on.
Yeah.
Arms around, because they have had it rough over the last 14 to 25 days. They have been working double shifts to make sure that Christmas can happen and be happy. And so when you pull the full family together of those folks who had the privilege of quarantining for the last 14 days, and then you exclude those couple family members that work at the hospital, that work at the grocery store, that can't actually quarantine in the same way or don't have the same privileges, it creates some issues in family as well. And so this is all, and I hate to be the one to keep throwing back the other thing, right? But it's this idea, okay, quarantine sounds great for me, sounds great for my family, my immediate family, not for all of us. And how do we create the space where everyone feels welcome, or say everyone has to do it from home because everybody can't do it? Those are conversations families are having, not just the quarantine conversation, but you too can quarantine because you got the good job, and y'all can quarantine because y'all with people every day. And so y'all can't come over, but we go cook and we go FaceTime y'all. What the? I mean, you go FaceTime us because we got.
Yeah, but Isaiah, you really kind of dipped into the next piece of the conversation I was going to have. So we may as well just stay right with it right now, because this whole issue of quarantine, and I know we had on deck Suzanne to talk about this quarantine versus isolation and this length of time. So it's really something that we need to talk about. I just want to make sure that our listeners remember, or those of you that are watching us by Facebook, or you either please put those questions in the queue. We still have panelists who are here to answer any questions that you might have, because what you offer is extremely important to our conversations today. And we don't have enough time to get to it all, but I appreciate you raising that, Isaiah, because we've had those conversations within some of our small groups. But it is a larger conversation, because if we're not able to touch, and I think this is where I have to be so careful, because I sometimes want to help make the data make sense to people so we can be making those informed decisions. And it is a challenge, because when we do share with people what we encourage them to do, sometimes there's some challenges and barriers. So I want to bring Suzanne Kupel forward now to just let's talk a little bit about what's available. I know we talked about isolation versus quarantine and these time periods, and then we also have the whole issue of even being able to get not the vaccine, but get the test when we need it. So give us a little bit of sense of this, Suzanne, in these next few moments. Where are we to really understand how this works?
So let me explain what happened with my own family. I have family members who were able to quarantine for 14 days prior to Thanksgiving. They enjoyed the holiday together as a pod with 2 households together. And they are going to be able to quarantine for the 14 days after they leave Thanksgiving. I can't do that. I work every day. I go to work every day. So I can't stay at home and do that and interact with them. So we're doing some things that are alternatives so that I can participate in the holiday with them, even though I can't physically be with them. So we do know that if we want to be together, we want to be able to protect ourselves and stay quarantined for that 14-day period. And this is guidance for quarantine and isolation. So if you are going to get tested for COVID-19, if you've had an exposure, you're going to stay home, you're going to monitor your health. And if you are in a household with other folks, you're going to keep your distance, you're going to wear your mask, even in your household. You're going to, again, take good care of yourself, make sure that you don't have direct physical contact, you're not using eating utensils, plates, cups, no towels, nothing that you have that you're using that's in common, and that you stay away from those folks and isolate, stay at home, and you are separated from the folks in your household. So you're going to be taking your temperature twice a day, and that's 30 minutes either after or before eating, drinking, or exercise. You don't want anything that's going to elevate your temperature when you take it. And that's also without taking those fever reducing medications like Tylenol. You're going to wash your thermometer with soap and water after each use. And you're going to be looking for those symptoms of COVID-19, a fever of over 100.4, a new or a worsening cough, the loss of taste or smell. And I've known a number of people who've had COVID-19, and they said that was the most unusual experience, not being able to taste or smell anything. Anything with shortness of breath, or two of the following symptoms, that's chills and sweating, sore throat, muscle pain or body aches, headaches, and that's new onset of severe headaches, diarrhea, vomiting, or abdominal pain, and congestion or runny nose. We also remind people that once you've been exposed to somebody who has had COVID-19, to wait 5 to 7 days after your initial exposure before you get tested, because it does take time for your body to produce the virus so that it shows up on a test. So if you do test positive, then you're going to isolate, and that's the other component of this slide, where when you've tested positive, you are now isolating because you've tested positive. If you're symptomatic, you are isolating because you have symptoms of COVID-19. And you're going to do the same things that you would do in quarantine. You're going to monitor your health for changes in your health. You're going to be keeping separation from your friends and family until you've recovered. And that's 10 days without a fever. And before you go back to work or before you go to resume regular activities, you're going to have at least 24 hours without a fever, without fever reducing medications, and a significant reduction in your symptoms of COVID-19. So all of those things are important. My plan for Christmas is to quarantine prior to spending time with my family, and quarantining after having spent time with my family. And all of that's dependent on whether or not we get vaccine in December, which it's looking very likely that we're going to get our first doses of the Pfizer vaccine sometime middle of December.
Okay, so let's talk a little bit about we talked about isolation, so I want to kind of move forward. Suzanne, we have testing sites in our community, and I wanted you to just remind us again that we are seeing people now going to those testing sites, and it's a little bit of a delay now.
It is. So we have 3 community testing locations, as you're all aware. All of our testing locations are seeing higher volume. That includes the urgent cares that people are going to. I strongly encourage someone to make an appointment if they can before they go to a testing location. That assures that you are actually going to be seen. If you don't have an appointment or you don't have access to the internet to make an appointment, you can still show up and they will accommodate you, but you may have to wait. We're making sure that people are appropriately social distancing and wearing masks while they wait for those appointments, but also recognize that the high volume of people that are getting tested now means a delay and when you're getting test results. So that's another challenge that we are all having to deal with as well.
Okay. And so these sites are still up on your website, and any changes to those sites will also be noted there on your website. I also Well, if you could just for a minute, Suzanne, just share with us when you talked about that there might be vaccines available, and I don't want to get too deep into the COVID vaccines, but they won't be available for everybody. Is that correct?
That is correct. The first delivery of vaccine will be specifically for those frontline healthcare workers who are working in the hospital. That includes EMS, people that are transporting COVID patients, and then physicians that directly treat people who are dealing with COVID-19. The next round of vaccine will go to first responders and to the long-term care facility residents, along with those that are more vulnerable, our frontline essential workers, the grocery store workers, educators, other folks that are regularly in the company of people that may have COVID-19 and not know it. So the 3 community sites are still available. The Walgreens in Flint still available. Hamilton Community Health Network at North Point and at the Burton Fire Station, and the 2 Rite Aid locations, one in Swartz Creek and one in Flint, are available to you, but just recognize they're seeing higher volumes because we're seeing larger numbers. So I want to remind everyone, we talk about numbers, but the numbers are sobering. As of yesterday, we posted 12,187 positive COVID-19 test results and 382 deaths in our community. And our positivity rate is still at 14.8. So it's a sober reminder that those things that we talk about for prevention are there to help keep all of us safe, keep you safe, and keep all of your loved ones safe. And these are the things we need to do in order to get the numbers back down.
Thank you so much, Suzanne. And I know Dr. Debbie also said that, and we've talked about this, that the numbers are challenging. And you said that again, but they are important for us to try to give some sense to. And you do a very good job, Dr. Deb, of synthesizing this. So can you give us, just help us with this data, the epi part of it?
Yeah, I'm going to give you the real practical, real fast. And again, I always tell people, I wish that data informed policy, but it's politicians who influence policy. And if we're lucky, we can use data to influence our policymakers. So as Suzanne said, our COVID rates are increasing. They're increasing in Genesee County and Flint. Our infection rates tripled from October to November. We've gone from about 157 per 100,000 to 497 per 100,000. So now honoring these protocols becomes way more important than ever. I'm always going to give the disparities update. And I bolded one sentence on purpose because I really need for people to understand this. There was a myth, like I want to call it a lie, when this first came out, that somehow African Americans were immune. And what we saw is once the virus took hold in communities, African Americans were substantially disproportionately impacted. And while we are only 60% of the population in Flint, early in the pandemic in March, we were 85% of the cases and 91% of the deaths. We made tremendous strides. All of the amazing partners from the health department, the Health Coalition, the Community Foundation, our philanthropic partners. We've got the Ruth Mott Foundation making substantial investments in North Flint, all of the work to support small businesses, including African-American owned small businesses, helped us to turn the tides. And in September, African-Americans were only 38% of cases and 58% of deaths. Well, we got all the data and we looked at October. And guess what? I keep telling people death is not the metric for us to look at. Why? Because we've done a much better job at therapeutics and figuring out how to keep people alive. But if you notice, the rate has increased by 25% among African-Americans. We're still underrepresented. Where in October, we were 48.2% of cases. That is a 25% increase over what we saw in September. When you look in the community overall, the rates are going up, the rates are tripling. And so that is not a huge cause for alarm. But what we don't want to do is have events like Thanksgiving, return to work, premature reopening, et cetera, have us lose all the strides that we made to narrow that disparity. So we've got our great rapid response initiative that was deployed through the Community Foundation of Greater Flint. That was deployed through, the Community Foundation of Greater Flint. And I want to acknowledge Isaiah Oliver, who trained me powerfully in how to be great with our local policymakers and our state, and how to really get resources that we know are vital to Flint. And that money has been rolled out, more than $2.5 million deployed in Flint. And so while these racial disparities have been eliminated, despite increases in cases, we've got to continually, ongoingly monitor these trends and ensure that all of the great work that we did to both get rid of the disparities and flatten the curve overall in our community don't get undone. So I think the conversation that we're having now about what does that look like, how do we be more practical with people, is so critical right now. But the rates are increasing, the disparities remain managed, but we're moving in the wrong direction on all fronts. And that's my report out. Hope it's not too alarmist, but I do want people to understand when this virus hits already vulnerable communities, the impact is greater. So people talking about not being able to go to work or because of these stay-at-home orders and other things, not being able to work because you've contracted the virus, and even worse, not knowing if you'll be in that group of long haulers who will deal with long-term impacts from having the virus. People are recovering and then still having trouble breathing. They're having scarring. They're having all kinds of problems that are cropping up that are also impeding their abilities to re-engage. So I just encourage everybody, more than ever now, we just need to continue to honor the protocols and keep having these practical conversations about how people can safely re-engage and what that looks like.
Yvonne, I just want to also say that we keep saying to everyone that we're worried about what's going to happen for Christmas. Recognize that when people gather at Thanksgiving, the incubation period is up to 14 days for COVID-19, that we are likely to see the impacts of these gatherings at Thanksgiving in the next 2 to 3 weeks, which would be right before Christmas. So it's really going to be at that time, we'll have an understanding of what the impacts were, people gathering at Thanksgiving.
Thank you, Suzanne. And also thank you, Dr. Deborah. It's sobering, but critical for us to understand. Dr. Reynolds, as the health officer, and just, you've shared so many things with us. You told us about some of the things that we need to have available. So we'd like to hear, again, a summary from you today about where we are and what your recommendations are going forward.
All right. I think we covered it pretty extensively because as the city health advisor, I follow the lead of the county and the state. So if you have any questions about anything I said, please check the county website. Please check the state website. And I don't know if this was mentioned earlier, but there is an app, My COVID Alert. It's in development, but you can get some basic information and connections there if you download it on your phone. So I will turn the rest of this over to my colleague, Billy Mitchell, who can tell you about exactly what's going on in City Hall and some updates on some information regarding water.
Thank you, Dr. Reynolds. Billy?
Good afternoon, everybody. I hope everyone had a great Thanksgiving. It was really good hearing everyone, the doctors and the professionals speak about the holiday and things we need to consider. It's been a really good conversation. So thank you for that conversation today. Quick update at City Hall. So it has been determined that we no longer will have a deadline for opt-in. Before, the deadline was November 19th. That has been extended indefinitely. When there is an updated deadline, I will be glad to present it to the group. Our attorney just reached out to me in the week later, like Thursday, I believe, to let me know. She'll keep me updated. And so you can still turn in your opt-in forms. You can turn them in online at www.cityofflint.com, or you can email them to me, bmitchell@cityofflint.com. You can call me if you have any questions, 810-237-2044 or 810-610-3305, which is my cell phone number. And I will gladly take your opt-in form down to Roe. As far as water filters, we do have our new feature, which is our walk-up window down at City Hall, downtown Flint. You can call us at the same number that we've been using throughout this whole pandemic, which is 810-410-2020. And we'll bag up your filter for you. We'll take it to the walk-up window and you can pick it up there. And so those are all the updates we have so far.
Thank you, Billy. Appreciate those updates from the city, both you and Dr. Reynolds. I just got this really cool, and that tells you how I'm old school, because cool is a word, but someone put in the Facebook post, it's worth the wait to isolate. So this kind of, I want to segue a little bit into Dr. Wolford, before we get to our close today. Dr. Wolford and Dr. Reynolds mentioned vaccines, and I know you were going to talk a little bit about vaccines today. Can you, we still have this issue, vaccines. There's a corona vaccine that's coming, but we have the flu vaccines that's coming. It just really, I still get tons of questions about the vaccine. So your insights previously were really helpful in some aspect. You could reiterate some of what you told us before about viruses and vaccines.
Sure, I absolutely would. I'm so happy for the opportunity. Thank you for the slide about childhood vaccines, because I think it's important to note that while we are so eager to get a COVID vaccine, because that will allow us to be able to go about our lives as we would like to without the concern of falling prey to COVID-19, we actually have great vaccines for a lot of other illnesses that are equally as concerning. And so when we have those vaccines, we don't want levels of vaccinations amongst children to drop. And actually, as Dr. Reynolds often reminds us, among adults as well. So we want people to get the vaccines that have been tried and tested. We know they help. And they protect us, and we would end up seeing a resurgence of illnesses such as measles and other things that we currently have vaccines to protect ourselves against. So we want people to go in and take their children in and get their routine vaccines, including the flu vaccine, so that we don't have to deal with both an upsurge in COVID and flu at the same time, and therefore contributing to overwhelming our healthcare system. So it's very important to go in and get the vaccines.
All right, thank you, Dr. Wolford. I think, did you have
one
more slide? You have one more slide.
About this one too.
Yeah.
So a lot of people sometimes don't want to get the flu vaccine because they say, oh, I got the flu vaccine and I got flu from the vaccine. And you really do not get flu from the flu vaccine. So I just wanted to emphasize that the vaccines use killed virus or little proteins from the virus, weakened virus. So none of that can cause the flu. So you maybe still get, it's possible to still get the flu, but the likelihood is you'd get a milder version of it, and so it would cause fewer problems for you, but you would not have gotten it from the flu vaccine. The flu vaccine would have actually protected you from having a more severe case. And so I just want to encourage people, if they haven't gotten it yet, that they should go out and get the flu vaccine.
Thank you, Dr. Wolford. It's really, these are questions I know we've answered before, and we'll continue to ask you to put your questions in the queue for us. And we've got our panelists, and I'm asking our panelists, we do have some questions. Please respond to the questions that are in the queue. One of the things that was asked about the COVID vaccine was, when would it be available for the public? And that
April.
is still, okay, so
this is Suzanne, and I can tell you that we anticipate it'll likely be April when the doses are available for the general public, and it's going to take time to get everyone immunized, but we are already in the planning process for that work.
Thank you, Suzanne, for that. And a number of things have come up in the Facebook queue. And Dr. Deborah, I'm going to ask you to come back because you mentioned the social pause. And so the two slides that we're going to talk about next and talk about the pause that the governor, the plan that the governor put in place, and a little bit about the social pause. Can you just fill us in on that? And we will cover this more in an upcoming webinar.
Yeah, sure. And I think this is going to be most relevant and helpful for us as we start to plan for Christmas and what's coming next after Thanksgiving. I'll just point people to the governor's website, michigan.gov/coronavirus. Both of these graphics were taken right from the governor's website. It breaks down a little bit about what's happening and where we are in our phases of reopening, which, as many know, we've had to dial back. So their big recommendation that I want to point to right now is the precaution that people not engage in more than 2 household gatherings. And as you can see, a lot of the places that would be linked with spread, such as schools, specifically the high schools and the colleges and universities, some of the larger places like theaters and movie theaters and stadiums and bowling centers, et cetera, all of those things are currently not open. I myself continue to try to do my part to support our economy, and I have picked up food from restaurants, but you are not allowed to go in and sit down and dine in restaurants right now. Indoor dining is all closed. So just as a note for people, and this remains a resource, go to the governor's website, michigan.gov/coronavirus. And then in upcoming, maybe next week, we'll talk a little bit more about social pods, because I know people hear the language and they say, well, what does that actually mean? So the basic concept is that a social pod is a core group of friends or family who mutually agree to limit their in-person social activities to only each other, to practice physical distancing with anybody that's outside of that group. And the whole point of creating social pods is to allow members to continue to see people who are outside of their household, while at the same time reducing the risk of spreading COVID-19 within their social pods. They've got some basic do's or don'ts. We can talk about that in the future, but a big do is agree on who is in that pod. Have a meeting of the minds. Be willing to have those conversations. I had my cousin who lives in Saginaw. We are our only 2 blood relatives in Flint that came with us for Thanksgiving. She got a COVID test in advance of her coming, and she's been in physical isolation before she came. So there's some do's and don'ts, and I think we can better unpack that in the future. But I want to make sure that people have real practical tools around that, and just to point them to our website put up by the governor that really kind of breaks it down and gives it to people in a way that's understandable. And I want to acknowledge our huge community affairs champion, Brother Gary Jones, who is actually on an off day today. And we all need that. We know we need that for our well-being. And if anybody needs more information, wants to know what's happening in the state, obviously they can reach out to Brother Jones. He sends out weekly reminders to us. He's at jonesg9@michigan.gov, and his phone number is 517-282-3193.
Thank you, Dr. Deborah. And as we round this session out today, I know you all know about the CEUs that are available for community health workers, and you know how to touch base with us. And so as we put that slide up for touching base with us in the next few days, if you want to like us on Facebook, subscribe to our YouTube channel, or even email us or give us a call. I want to spend this last 30 seconds to give our friend Isaiah Oliver the last word for today, as he has helped us stand up some really important things for the Community Foundation of Greater Flint. Isaiah, you got about 30 seconds to give us that last word for today.
You know what? I wasn't expecting to get the last word. So I appreciate the opportunity to be here with these amazing minds, Dr. Wolford, Dr. Deborah Furholden, Dr. Reynolds, you, Miss Lewis, and all of the work that you're doing in this community, Billy and Suzanne Cupel, and a few other folks. Thank you all for allowing me to use the first 30 seconds of that to tell you thank you. I'll close by saying that we're at our best when we all have the tools and the information we need as a community to move forward. And today has been another great example of the Healthy Flint Research Coordinating Center actually providing the space and the platform for people to share information and receive it. So thank you for all that you do. as a community, we're going to move forward. We're going to ask the tough questions, and we're going to address this pandemic, not only in our community, but hopefully be a model for the rest of the state and the country. So thank you for all that you do. God bless, and enjoy the rest of your holiday weekend.
Thank you, Isaiah. And join us next week right here for the 38th Flint Community Webinar on Coronavirus, sponsored by the Healthy Flint Research Coordinating Center. Thank you all and enjoy the rest of the weekend.